Hello everyone, welcome back. Today we will be looking at the different diagnostic tests and procedures used to assess the cardiovascular system. Before we begin, I highly recommend reviewing the anatomy and physiology of the heart, as this will help you better understand why each test is performed. Now, let's get started. Let's start with exercise stress test. During this test, you will walk on a treadmill or cycle on a stationary bike while your heart is closely monitored. Your heart rate, breathing, blood pressure, and electrical activity are recorded to evaluate how your heart responds to physical exertion. But what if someone is not able to exercise? In that case, medication is given to stimulate the effects of exercise by widening the coronary arteries and increasing blood flow. Images of the heart are then taken at rest and during exercise to identify areas receiving reduced blood supply. Another helpful diagnostic test is tilt table test. In this test, you will be asked to lie on a table that gradually moves from a flat to an upright position, while your heart rate and blood pressure are monitored. This tilt table test is useful for investigating symptoms such as dizziness or fainting while you are standing, also known as syncope. CT Coronary Angiogram or CTCA use multiple X-ray images to create detailed 3D views of the heart and blood vessels. With contrast dye, it can clearly detect narrowing or blockages of the coronary arteries. Let's move on to coronary angiogram with cardiac catheterization. In this procedure, a thin catheter is inserted through your wrist or groin and guided to the heart. After contrast dye is injected, cardiologists can clearly visualize how narrow the arteries are, often described as percentage of stenosis. For example, you might hear 50% of stenosis in LAD. If necessary, a stent can be inserted to open the artery, but if the stenosis is severe, the patient may be referred to have coronary artery bypass graft surgery. Cardiac MRI is particularly valuable for assessing heart muscle damage. With contrast dye, it can show blood flow to different regions of the heart and identify scarring or areas with reduced perfusion. MRI also provides detailed information about heart anatomy, including the valves, chambers, tissue characteristics, and pumping function. While MRI can assess large vessels like the aorta, it is less effective than CT scans in detecting plaque in small coronary arteries. Because MRI does not use radiation, it is generally considered safer, although it may not be suitable for individuals with certain metal implants, such as a pacemaker or a defibrillator. Now let's look at heart rhythm monitoring. The most common heart rhythm test is electrocardiogram, ECG. In this test, electrodes are placed on the chest, arms, and legs to record electrical activity. ECG will show heart rates and heart rhythm from different angles of the heart. If a standard ECG does not capture the issue, portable devices such as a telemetry or Holtor monitor can be used to record heart rhythms over hours or days while you continue your usual activities. For long-term monitoring, a small device can be implanted under the skin of the chest. It can track heart rhythms for up to 4 years, automatically detecting abnormalities or recording events if the patients manually activate the trigger if they are symptomatic. Another common procedure used to assess the cardiovascular system is Transthoracic Echocardiogram, TTE. It is a non-invasive ultrasound performed on the chest wall. TTE is used to assess the functioning of the heart valves and the size or shape of the heart chambers. TTE also measures the pumping ability by calculating how much blood the left ventricle pumps out with each contraction, also known as ejection fraction. Normal ejection fraction ranges between 55 to 70%, and anything lower can be a sign of failure. Last but not least, we have Trans-oesophageal Echocardiogram, which is also called TOE. TOE is a procedure that is used to examine the heart valves and chambers with a flexible probe passed down the esophagus. Because this is a more invasive procedure, TOE provides clearer and more detailed images than TTE, helping clinicians obtain more accurate and definitive information. TOE allows close assessment for conditions such as blood clots, tumor, infection, valve disease, structural abnormalities, and problems involving the aorta. That's the end of our video, and I hope you found it helpful. If you have any questions, please leave a comment below. Otherwise, I will see you in the next video.